reason that we picked the Calidus software suite is we were using a vendor package that was about 12 years old, and we had customized that package to such a degree that the vendor wouldn't support it anymore, and it was in a very fragile state, and we were worried that it could blow up at any point in time. Associated with that was the fact that we had to introduce new products, and when those products got launched, we had to build Excel spreadsheets and access databases and things like that to actually pay commissions on or for those products. So that was a big concern for us. So those are the two major driving forces for why we needed to pick a new solution. Obviously, our internal auditors weren't real thrilled with the fact that we were using the Excel spreadsheets and the access databases for making payments. So those are pretty much the biggest concerns. There were some rumblings about whether or not we were paying accurately or paying completely, but there wasn't a whole lot of justification for that. It was just a sense that some of the producers had that it just doesn't seem like you're paying me exactly what I was expecting to get paid. And as a result of that, they were spending a lot of their own time taking a look at were we or were we not paying them correctly. So pretty much those were the reasons why we picked Calidus. When we purchased Calidus, we had a need to be able to pay anywhere between 6,000 and 10,000 independent agents. We pay them commissions for selling our products. So typically on a given month, we have somewhere in the neighborhood of between maybe 4,000 to as many as 6,000 agents that we're actually paying on the system. We pay them for selling health insurance products, so that would include medical products, prescription drug coverage, dental coverage, vision coverage. So as they make those sales, we're actually paying commissions to them for that. We're also using the system to pay their incentive and bonus programs for those very same products. So that's how we're using the system today. Now, prior to actually going to the Calidus implementation, we had very few metrics that we were using to be able to verify how completely we were paying from all the cash payments that we received from our customers and how accurately we were paying. So one of the things that we did at the very beginning of the project was to make sure we had controls in place and measurements in place so that we could, for the very first time, keep track of how accurately were we paying, meaning that what should have been paid actually did get paid, versus of all the payments that we did receive, did all of those get paid or not. So we put those metrics in place before we launched the system, and I'm happy to say that we've had tremendous results in implementing the system and actually achieving those targets. So we're on course now between now and the end of the year, which would be the end of 2011, to actually either meet or exceed the threshold, target, and outstanding levels that we have set for those two key measurements. The other thing that was important to us to make sure that we could pay by a specific date. Typically we had paid by no later than the 14th of the month, but because of the way that we put the system in, we put in way more complex payment schemas this time. So we were going to need a couple of extra days to make sure that we could get all the data that we needed to make that happen. Now our target is to be able to hit the 15th of the month. We're currently averaging around the 16th, but we need to be by the 15th by the end of this year. And once again, I'm highly confident that we're going to be able to get there. So once again, that measurement is expected to be met. One of the benefits, or I should say the series of benefits that my team are expecting to achieve as a result of implementing the Calidus suite, fall into a number of different categories. As we spoke about earlier, that we expect to see far better improvements when it comes to paying accurately and paying completely, as well as paying on time. Those are always very important whenever you're paying anyone for commissions, incentives, bonus, etc. The other things that are really important to us is we want to be able to make sure that as our leadership comes up with newer ideas for how they want to pay in the future, that if it's changing the payout amounts, that it's not taking any more than 30 to 60 days to make those kinds of changes. The other thing that's really important to us is to be able to make structural changes to how we pay commissions. And for those kinds of changes, we're hoping to be able to accomplish those in 90 days or less. Under our former system, we were lucky if we could do something like that in a year, maybe a year and a half. So those are tremendous benefits to us. The other thing that's a benefit to my team is when we implemented the system, we just didn't implement a new system, we implemented new commission designs. And those designs had tremendous savings for the corporation. We were expecting to realize a certain amount of savings within a 3-year period. I'm very happy to report that we're on course to actually achieve those savings within a 24-month period. So we're saving what we expected at a far faster rate, and that's a tremendous benefit to our company. From the producer perspective, by implementing the system, our goal was to make it happen in such a fashion that they really didn't even know that we implemented a system. What tripped that up a little bit is the fact that we did reduce commissions as part of this process. So there's a lot of angst that you pick up anytime that you reduce someone's compensation. So most of the difficulties with the implementation have been focused around, gee whiz, I don't like the fact that my compensation has been reduced. But from the systems perspective itself, we've had nothing but positive responses about being able to pay on time, pay accurately, and pay correctly. So that has gone really well for us. When you think about health insurance and the payment of commissions, we're all going to be heavily impacted by national health care reform. Now, a lot of things still need to be defined, but one of the things that's likely to happen is the amount of money that we can actually pay on commissions could be negatively impacted from the standpoint of it needs to be lesser than what we're paying right now. So that would have a tremendous impact on independent agents. Some question whether or not there's even going to be a role for an agent to play in the future. Is everyone going to go online and try to buy their insurance over the internet? So those are some of the things that have the biggest impact on agents in the healthcare industry going forward. From our perspective, we always believe that there's going to be a need for an agent to help an insured pick the right kinds of coverage. And we do expect that we'll be paying commissions to them for that service. The question will be what kind of limits or controls will we need to put in place to make sure that we're meeting any kind of guidelines that get established as national healthcare reform gets further defined for us. So when we first picked software, the Calida software suite, we were thinking that we were going to host it ourselves. We ran into some business issues corporately as far as we changed our mind about the comp designs that we were going to actually roll out when we rolled out the new system. And during the period of time that it took us to figure out the new payment designs, we took another look at whether or not on-demand would make sense for our company or not. And we actually chose to go on-demand. And I can tell you that was probably one of the best decisions that we ever made. Let me give you an example. The system that we replaced, we had for a 12-year period, and we customized it to such a degree that we couldn't take advantage of any new functions and features that the vendor came out with. The other thing is that being a not-for-profit organization, we have to go through a lot of hurdles to be able to get funding, to be able to do upgrades to existing systems and things like that. So we've been using on-demand for a 1-year period now. Service has been outstanding. Anytime an issue has cropped up, it's been immediately addressed. So that's been very positive. And there's a newer version of the software suite available to us now that's called Monaco. And I would have to, under the old approach, go to my strategic planning unit, get all the documentation put together to be able to write a business case and try to get approval to get some funding to actually go to Monaco. Right now, we're on target to actually implement Monaco before the end of this year. So there's tremendous functions and features that'll be a benefit to us that I'm going to be able to take advantage of way sooner because I chose to go the on-demand path. So I'd encourage anybody to really take a hard look at on-demand for those kinds of reasons.